Hi, I'm Bob Schrupp, physical therapist, providing you with treatments that you can do within the confines of your own home, which is pretty cool, I think. Today we're going to talk about heat versus cold. This is one of the most common questions I get asked is by my patients, should I use heat or should I use cold? Well, first I'm going to start off, what are the couple instances in which you should absolutely not use heat and absolutely not use cold? And then there's a lot of instances in which you could use either. So let's start off with the cold. When should you absolutely not use cold? I would say with arthritis. In most cases, arthritis does not feel good when you put cold on it, and a lot of the arthritic joints are very stiff. So to put cold on that is certainly not going to make it less stiff, it's going to make it more stiff. So I think people pretty much will understand that, but that's a case where you would not use cold. When would you absolutely not use heat? This is probably a little more prevalent. If you have what we call an acute injury, that is an injury that just happened, and quite often what happens after that injury is that you're going to have swelling, inflammation, and maybe even some slight bleeding. That's that bruising that you see that goes on. You're going to want to use cold. Now, most people understand that's very clearly and easy to understand after like an ankle injury, because you can see the swelling, it swells up, and you can see the bruising. But what they don't understand is the same truth holds sway when you want, if your back, let's say you just hurt your back and you have an acute back injury, you need to put a cold pack on there too, because there's swelling going on, there may be some bleeding, there may be some bruising, it's just on a deeper level and you're not going to be able to see it. So any acute injury, any recent injury, I'd say for the first 72 hours, that's 3 days, you're going to want to use ice. Now there are instances in which you're going to want to continue to use the ice. I would say after a knee replacement. If you've just had a knee replacement, a lot of our patients keep ice in that for weeks and weeks because the swelling goes on and it just feels really good. Ice, I believe, tends to penetrate a little deeper than heat. So if you want something that goes down a little deeper, I think the ice will do it. It's not unusual to keep using ice on back pain too for the same reason. It seems to penetrate a little deeper and it seems to help with back spasms. But after the 3 days, you could try heat. You actually could even do both. Sometimes people use the heat to try to kind of open up the capillaries or blood vessels, and then the cold closes them up. And by doing that back and forth, you actually get kind of a pumping sensation and you get more blood flow to the area and actually helps it heal quicker. If you're going to go back and forth, what you want to do is first go with 4 minutes of heat and then 1 minute of cold. 4 minutes of another heat, then 1 minute of cold. We often have that done when we show people how to do what we call contrast baths. That's where you take one sink and you fill it up with hot water, and one sink you fill it up with cold water, and you do the 4 minutes, let's say it's for your hands or your feet. You put your feet or hands in there for 4 minutes, 1 minute in the cold, 4 minutes. Anyway, you can go up to 20 minutes and that works pretty well. I would also say that ice is good for like chronic injuries. I've seen a lot of people have good luck with chronic injuries and also with overuse injuries. My son was having trouble with shin splints, and after running that seemed to work really well to throw an ice pack on there. Heat works really well for if you're trying to get ready for an activity. If you're warming up for an activity, you want to put the heat on before, and then a lot of times you ice afterwards. Heat helps flush out the chemicals such as lactate, and it's good for, to help stop the soreness. Heat is also good for relaxation. I would say it's a lot easier to relax with a hot pack on you than it is with a cold pack. So those are the general guidelines. The rule of thumb, the two absolutes is do not use ice for arthritis, and I would not use heat right after an acute injury. All right, good luck, and please subscribe if you haven't already. Thanks a lot.